Basically, a vaginoplasty involves tightening up the vagina and the vaginal muscles to make sexual intercourse and intimacy more effective and more pleasurable for both partners. And that's the reason that most people come in for a vaginoplasty. And in technical terms, it's the pelvic floor that we sort of reconstruct because that everything gets stretched out with childbirth. And those are really the patients that I see, the patients who've had multiple, or sometimes one, but often multiple vaginal births, and everything has been stretched out. The vagina itself has been stretched out, the vaginal muscles have been stretched out, and sometimes there just isn't the right contact
Mm.
for the pleasure of intimacy that was there before childbirth.
Right. And are there any sort of motivating events or occurrences that all of a sudden would make a woman decide it's time to fix this? Or have you been able to figure out any common theme?
Well, I think it's something that people don't talk about, and even partners don't talk about it. But when they do start talking about it, and then they can go online and read about it, and there's a lot more in the news about it now than there used to be. When I started doing these procedures, vaginoplasty, labiaplasty, it was something that was sort of hush hush and nobody talked about. And I went and got special training in doing this, and now it's a much more common theme, but still there are very few surgeons who specialize in this like I do. And so it can take a little searching. And it's important that you find somebody to do this surgery who's done it before, because it can be a little tricky, and there's a lot of judgment involved, and every woman is different, and every woman has a different need. But I think it's a communication between the two partners that really spur people to come on in. And often women come in with their husbands, and their husbands have questions, and so on and so forth.